Hi everyone, I am Dr. Bernice Stella, ENT surgeon, and today we are going to discuss briefly about tonsillitis. So I will start with saying what are tonsils. So tonsils are these tissue which is there in the back of our throat, and they tend to get infected time to time. So I'll say brief things about what is tonsillitis and what are the symptoms that we have to be aware of and how do we treat it. So let's come to say a small introduction of what tonsils are. Tonsils are these tissue where that's like the gatekeeper in our body. Any infection that enters our body through mouth or through any other means, the cells in the tonsils, they get activated and they alert the whole body to fight against this infection. So that is what the main function of tonsils are. So when there is a lot of infections, tonsils tend to get enlarged. Is that they become big in size, and that's along with other symptoms like pain in the throat or difficulty in eating. All those can occur. So we have two types of tonsillitis, which is the infections in the tonsils. We call it as acute and chronic. We say it acute based on the duration when the patient has the symptoms of tonsillitis for less than 10 days. And then this kind of episodes, they occur recurrently throughout the year, significantly causing loss of work days or loss of school days in a person. Then we call it as chronic tonsillitis. I'll come in detail about it later. So we'll talk about the symptoms. So anybody who has tonsillitis can have the following symptoms. They can have sore throat, which is pain during swallowing, and they can have difficulty in swallowing. So when the tonsils, as I said earlier, tonsils are in the back of our throat and we have to swallow our food through mouth, which goes through the throat. So when the tonsils are becoming bigger, it is difficult for us to swallow food. So there is difficulty in swallowing, and then as they become bigger, we can have difficulty in breathing also. Sometimes chronic tonsillitis can have a bad breath. The tonsils, as they are bigger, they can have small dips in the surface of the tonsil, and that can accumulate a lot of our food products when we eat, chew and eat. They can stay there for a long time and can cause bad odor, that we call it as halitosis. And lastly, tonsils can also lead to a lot of snoring, and in elderly we call it as apnea. In kids also apnea can occur because of tonsillitis. Why does tonsillitis occur? So tonsillitis occurs mostly because of, along with pharyngitis, we say the throat pain. So the virus or bacteria which is there in the throat causing our throat pain can jump into the tonsils and cause infection of the tonsils. And sinusitis or a toothache, the bacteria from there can actually go into the tonsils, can cause tonsillitis. So there are different signs we call that doctors see in a tonsil in a patient to diagnose tonsillitis. So they can come to you and say, doctor, I have the following symptoms. I have sore throat and I have difficulty in swallowing food, and I have small swellings on my neck, and I have difficulty in breathing. All these can occur in tonsillitis. So then we examine the patient and we see that the tonsils are bigger and they are reddish looking than the normal tongue or the back of the throat. They look more redder, and sometimes there can be yellow spots on the surface of the tonsil, that is called as an infective tonsil, or rarely a white membrane or a gray membrane can be sitting over the tonsil, which is difficult to peel off. So these are the types of tonsillitis that doctors come across. So that's how we see, and we run some basic bloods to see how their infection is, what are the blood counts, and how bad is the count of their cells which tell us how much infection is there. So we run the basic bloods, but basically this is a diagnosis that we see the throat and we make the diagnosis. And then we start the treatment. So let's say it is only a 10-day infection and we call it as acute. We encourage the patients to take lot of fluids, which is good hydration, and then good healthy diet, a good proteinaceous diet, and then we put them on painkillers, because tonsils, if they are infected and it is very painful and they are not able to eat, so when we say drink lot of water and then they have something sitting in the throat, it is difficult for them. So we give them good painkillers so they can take adequate food and water. And then the last and most important thing is we give them antibiotics. Antibiotics are the drugs which fight the particular bacteria which is sitting in the tonsil and also in the bloodstream, so that the infection goes off. So this is basically how we treat acute tonsillitis. Let's come to chronic tonsillitis. So there's something, we have a criteria to say when the patient has chronic tonsillitis. For example, if the patient, an adult or a child, gets recurrent episodes of acute 10-day tonsillitis 7 times or more in a year, or 5 times in a year consecutively for 2 years, or 3 times in a year consecutively for 3 years, this we brand them as chronic tonsillitis. Or they have school absence or work absence for more than 2 weeks in a year because of tonsillitis, then we call it as chronic tonsillitis. So these patients, they will not have pain all throughout the year, but any small trigger, they get a small infection, or they go somewhere, they travel elsewhere, they drink a different water, or they take an ice cream or juice from elsewhere, their immunity is down and then they pick up the infection very fast, and the tonsil, which was already inflamed and became better, suddenly will give another infection episode. So this is how a chronic tonsillitis occurs. Such patients are treated a little differently. So again, we'll do the same workup. We do the basic bloods, and we give them antibiotics. If it is not subsiding with tablets or syrup formulation, we tend to admit the patient and give intravenous, the injection antibiotics, for the infection to wear off. Even after so, the patient complains that I'm unable to swallow, and something is sitting in my throat, and it is also difficult to breathe. So such patients, we see the size of the tonsil and grade the tonsils, saying 1, 2, 3, 4 based on the sizes, and we take them for surgery and we take it out. So as you can think, I was saying in the first part of this video that tonsils give immunity. They are the watchmen of the whole body. So then you can have the question, when you're going to take the tonsil, what is going to happen? So there's nothing to worry. Tonsil are not the only tissues in our body doing that function. When they cause more damage by giving recurrent infection, taking them out is a better option. But caution should be thought when the kids have tonsillitis, and we don't usually immediately take the tonsils out, especially when they are 3 years or younger. Coming to the surgery for the tonsil, it's a very short duration surgery, but the pain following the surgery is significantly higher, but we deal it with adequate painkillers. And following tonsil surgery, there will not be another episode of tonsillitis ever in the patient's life, because the tonsils will be removed completely. So that is one. You can also ask, what if we are not opting for surgery? What may be the complications if we leave the tonsillitis untreated or partially treated? So there comes a lot of complications. Some are very life-threatening. So as tonsils are in the throat, it has adequate access to the tissues in the back of our throat, basically in the neck, and in the sides of the throat, where we have a lot of small spaces which can easily get infected. So this infection from the tonsil can go to the back of the neck or the sides of the neck, can cause abscess formation. So these abscesses will not be sitting on the same place, they will trickle down till our lungs can go for infection, can be life endangering. Another infection is It can cause abscess right above the tonsil or on the sides. We call it as paratonsillar, peritonsillar abscess. And the patients can have apnea or sleep apnea. As I mentioned earlier, they can snore because of the size of the tonsil sitting in the throat, and such snoring on a long term, it reduces the oxygen supply that goes to the brain, which is not very helpful, especially for adult patients with other comorbidities. So such patients, we have to take out the tonsils as earlier as possible. Then acute, if not treated properly, leads to chronic, then chronic, all this complications. So that's about tonsillitis. Thank you.